It's a bird.
It's a plane!
It's the Glute guys.
Hello, everybody. Welcome to the Glute Guys Network. Today we have another special guest, Anthony Falco, a physical therapist for almost 12 years, completed orthopedic residency training and a fellowship in orthopedic manual physical therapy. Currently the vice president of the APTANJ and the physical therapy manager at Summit Health in Northern New Jersey. Thank you for being on.
Thanks for having me. Happy to be here.
So, say that again, Tommy. I think you're cut off for a second.
I was just saying I'm excited to have you on.
I guess we'll just dive right into it. You
Sure.
are the vice president of the APTANJ. What is up and coming? What's coming up for the APTA?
First, so in APTA New Jersey land, one of our biggest kind of recent changes is we have a new executive director. So our previous executive director of 10 plus years has moved on, and he put us in a really strong position. And at the beginning of this year, we hired a new executive director who is starting to put his mark on our organization. And with the leadership team that we have in place with the council of directors, we're working towards kind of updating things a little bit. So new website is in the works. Start continuing to offer online offerings in regards to continuing education and webinars, which we've done a great job of since the pandemic. Also, we're having a huge push for engaging students and young professionals. So we're continuing to work on programming and connecting with students even early on in their programs so that we can show what APTA and APTA New Jersey, what we are, who we are, and what we do, and what the value is. So those are some of our current initiatives and things that we're working on an organizational side. And then there's always things that we're working on legislatively. So over the last, recent number of years, we've codified dry needling. So that's legislation that's gotten passed. In the more recent kind of past year or so, we secured a 15% increase in reimbursement from Blue Cross Blue Shield, and are always advocating for things that can help physical therapists do what we do best, which is take great care of patients and provide high quality care. So whether that was supporting our pediatric PTs during COVID and facilitating communication between stakeholders, whatever the issues are, those are always things that we're trying to be on top of and look out for. And that's really what APTANJ is about, is kind of maintaining and enhancing the field of physical therapy in New Jersey. So that's a big general overview. Happy to dive deeper, provide more. Go ahead.
Well, I definitely thought about a few different things with just that. How do you think do you think COVID or just the last few years has changed how new grads are coming out? I guess the quality of PTs, I guess in New Jersey, or do you think it's about the same?
I think COVID threw everybody for a loop, whatever stage you were in, whether you were in undergrad, whether you were in PT school, whether you were a new grad, whether you were a vet who's been in the field for a number of years, having a transition to be able to do some virtual stuff. So I don't think it's fair to say that COVID negatively impacted the quality of the student that's coming out of school, but to say that it didn't have an impact in some way also, right? It's somewhere in the middle, right?
Yeah.
I think that as a professional organization, as the state association, whether COVID happened or not, our role is always to try to help students and young professionals see the value in what we provide, but also understanding that time period of COVID for kids who are in PT school now, maybe they missed a chunk of undergrad and didn't get as much clinic experience or in-person experience, or even just working that side hustle job, bartending or waitressing. They just there's a chunk of time where they were not, all of us were not, socially out there. So I think that certainly that's a place we see the association is to facilitate making sure that our young professionals and our new grads are prepared to be in the workforce, COVID or not. So I don't know if that is a question, but I think it certainly is something that we recognize is an important thing to provide to our students and young professionals, is ways to develop their careers and to connect with people who have done it before so they don't have to reinvent the wheel and things like that. So
Yeah, I think like the connection between professionals is always a huge part of it. Like I know, like I guess starting with my company where I'm just sort of by myself a lot, it's good to have people that you can reach out to if you need it, because it can definitely be a little wonky when you're, at a person's house and something a little bit more extreme is happening. It's good to know like you have a support system or someone around. Like I didn't even mention in the intro, which I should have mentioned. You were my clinical instructor, so my first teacher I had as in the clinic was Dr. Anthony Falco right here, and I would say you did a very good job.
He's the reason you are as good of a PT you are today.
Hey,
Well, look at you. You went on to start a podcast, and here you are talking shop. It's a beautiful thing, and yeah, no, it was a pleasure having you in the clinic, and it's cool to see, where you guys have come and progressed to, and that's part of what keeps me engaged. In something like APTA New Jersey and being at a level of the vice president of the organization is having the ability to help students like yourself, like as a clinical instructor, but also to be some of that professional network, right? And provide an organization and structure to an organization that can help students get to where they want to be and do what they want to do as they transition to professionals. So
mhm,
yeah, it all kind of comes together for me like that. I love having students. I loved having you in the clinic, and working with a whole bunch of Seton Hall students at that
mhm.
time. But yeah, I think it's important. I think it's something that I feel like it's one of my duties to the profession is to, give back and help other people kind of come up in the ranks of the profession.
Yeah, I love that you're taking now your role in the APTA and you're expanding it further, even into like you helped us out so much as students as well, that you're taking it that step further and you're getting to us in like our classroom stages now, and you're showing the involvement with not just like APTA and like as a whole, but like specifically the New Jersey chapter and what's going on and how we're like you're revamping the website and changing a lot of the social media aspect stuff, because it's a lot of the things that those like students now use. A lot of the tools that they jump to are a lot of the social media stuff, so it's going to help them tenfold when they do enter like the clinical realm too, and just knowing that like, all right, this is what APTA NJ is doing and working towards for us right now.
Mhm. I think that's why it's nice, like you said, that we have the podcast too. It's just a different way for us to get our voices out there a little bit, and it's like one of those things
Absolutely.
you never know who is actually going to see it,
Yeah,
and
Yeah,
hopefully it helps a few people along the way.
absolutely.
we're having
uh,
fun and learning while we're doing it, and that's the most important thing.
mhm.
That's what it's all about.
Now the big question, if because I definitely know a few people that are like, I don't want to be a part of the APTA anymore. Like I feel like it's not helpful for me. What would you say like the big things are for the people who've maybe been in the field for 5 years and are like, why do I need to pay this fee or whatever it is to be in the APTA?
Yeah, absolutely. I think for me, a mentor of mine earlier in my career, even as a student, actually kind of said something to me that just stuck in my head, and it's something I always use as part of the answer to this question is, if we don't take care of our profession, who will? Right? We
Mm-hmm.
need to be the stewards of what physical therapy is, and I feel like from my beginning time in PT school, I always had this vision of like what the like ultimate potential of what physical therapy could be is. And so for me, it's just kind of always been ingrained from when I was a student. And I was lucky to have mentors and professors and have experiences that just clicked in my head and were like, this totally makes sense to me. Like this organization and being part of this organization, contributing to this organization is one of the ways to help move this profession forward.
Mm-hmm.
I think the hard part is, and I recognize that if all you do is pay the dues and get access to some journal articles, the return on the value is probably not there. Right? I'll be
Mm-hmm.
the first person. But if you connect and attend some networking events, if you get involved in your local state chapter, if you pay attention to some special interest groups that maybe connect to a specialty area of practice that you want to engage in or learn about or decide if it's a direction you want to take your career, APTA membership and APTA involvement can pay itself back in dividends because it can help you get mentorship that maybe you don't have in your clinic. It can help
Mm-hmm.
you when you are a therapist doing PT in the home where you are the only person there, have other people even outside of your company structure that you can bounce ideas off of, or share best practices or connect to on tough cases. So I think that APTA and APTA New Jersey do a great job of providing a lot of that content. Sometimes, and I'll be the first to admit as well, we're not the best about marketing that, and that's something that we certainly are working on and going to improve to get better. Definitely at the state level, where I have a leadership role, is something, as I mentioned, with our website and our social media, is working to expand our presence and be more consistent and kind of modernized in our approach to those platforms. So I think, as with most things in life, like whatever you put into it is what you'll get out of it. So
Mm-hmm.
even just a little bit of engagement or committing to like attending one meeting, twice a year or once a quarter, or checking out the website to see what kind of events and things are going on, and volunteering and giving back to the profession. Again, the who's going to look after our profession if we don't
Mm-hmm.
is nobody, right? And legislatively,
Yeah.
things can really get out of hand, where other professions and other stakeholders are going to try to, encroach maybe a little bit in our territory, and we're the ones that stick up for ourselves, and because if we don't, nobody else will. So that's my quick elevator pitch. I could talk about APTA, New Jersey, and APTA stuff, for as long as you want me to, but without getting up on my soapbox completely, I think that there is an immense amount of value, but you have to put a little bit of effort forward to get it. And if you look around online, you can find a million reasons why APTA National or APTA New Jersey, they're not doing this, they're not working on that, they're not doing this. I think part of the education process for me was understanding, well, what is in our jurisdiction as a professional association? What are the issues that we can work on and make progress on? And then what are the issues that maybe it seems like we should be working on or working on harder, but actually are not able to be impacted as directly as people might think outside of the organization. So there's I first got involved with APTA and APTA New Jersey to kind of learn how it all works, so I could better answer that question. Well, what does APTA do for me? What does
Yep.
APTA New Jersey do? And it's taken me on this long winding road of now being the vice president of the organization, but really learning how decisions are made, how priorities are set. There's a lot of really smart and passionate people that are a part of this organization, and even though, depending what corners of the interwebs you go and look on, APTA might get bashed in certain places, there's a ton of good work that's happening all the time, and you don't always hear about all of it, but there's a lot of passionate people working really hard on a lot of different angles to try to help make this profession better and reach its full potential, like I was saying earlier. So
Mm-hmm. And I guess that's a big thing too. You sort of went into it, that there's a lot of other professions that are going to try to like encroach and take some of the stuff that we're supposed to do. So it's good to have a voice out there instead of just sort of letting things happen. And I do know that like we can tend to be a little lazy when it comes to that standpoint too. I definitely know people. I definitely know sometimes myself, honestly, too, can get a little bit like lazy with that type of stuff. But yeah, like an active role in it, like it makes sense. You have to, put some time into it to get the full benefit out of it.
Yeah, and listen, we all are busy, right? Life is busy. Life happens at 100 miles an hour every year. I feel like you get out of school, it's like, oh my gosh, I feel like I have less free time now than I ever did before. Then
Yep.
next year, even less free time. So life comes at 100 miles an hour, but I think that's why that's part of my also my motivation is I understand that, right? Like I know not everybody necessarily has the time or the energy to direct towards being in a leadership role or a leadership position. So it's one of my passions, is trying to find ways that there can be these kind of bite-sized chunks, easy to digest information, actionable information that can be useful to people that have full-time jobs and are running clinics or starting families or getting married or traveling and living life, doing all the things that having a great job like being a physical therapist allows us to do. I think is part of why the professional association is important, to allow us to enjoy full lives, but also be able to practice at the tip of the spear and be at the peak of our license and out there impacting people's lives in a positive way, with what we do every day in the clinic. So
Mm-hmm. Makes sense. I guess, what was that, Tommy? Oh,
No, I was nodding and I was agreeing with it.
I guess we'll transition into some other stuff, maybe a little bit of just your personal, I guess, fitness, your personal journey in general. I know you're always big into CrossFit. What's been going on, I guess, just personally recently? What have you been working on as an athlete?
Sure. Yeah, so I was into CrossFit for a little bit over 10 years. I took the level 1 certification a couple times actually. And I love CrossFit. CrossFit is great. I think one of the things that happens as you progress through life, so I have 2 kids now. I have a 4-year-old and a
Yep.
6-month-old.
Congratulations.
Time, yes, thank you, thank you. As I was mentioning before, time gets compressed, and as much as I love like driving to the gym, taking an hour-long class, and then driving home, the time component for me has become way tighter. So I'm no longer working out at, let's say, at a CrossFit gym, um, or maybe not necessarily what I do on a weekly basis. Somebody who does CrossFit might not call it CrossFit, but I think a lot of the principles, a lot of the movements for sure, and a lot of the positive things that I learned from being engaged in CrossFit as an athlete and certainly as a physical therapist, I still apply to the way that I work out now. I currently work out following some programming and coach at a gym called Between the Ears Fitness. So I coach a class there once a week and follow some of their programming. So it's a great little gym, a very unique approach to fitness focused on mental, physical, and emotional health. So, kind of matching your workout that you do that day to where your kind of physical, mental, and emotional state is. So, we have a pretty cool little system through that gym. And that's kind of what I see has been like an evolution for me from CrossFit to better kind of fit I need for my life now. And um, I think the speaking of where like I am as an athlete is where I maybe 6 or 7 years ago before kids, I'd go to the gym and just kind of crush it
Yeah.
and try to get after every day. I'm much more in a thinking about how my fitness serves me versus
Yeah.
me serving my fitness, if that makes sense. So trying to help my workouts support what I do on a daily basis when it comes to work, to being dad, to feeling good, to sleeping well. Trying to figure out and kind of navigate those waters of how can my workouts and my fitness routine be supportive of the rest of my life versus like working out so hard that I need like 3 days to recover and I can barely walk down the stairs or whatever. So
Yeah.
yeah, it's been an evolution, but yeah, happy to dig into any more of that you want. But
Yeah, but I
that's
guess,
where I'm at
yeah,
as far as a exerciser myself.
like I think we talk about that a lot on this channel. Like we're not
Oh, yeah.
really working out to be a professional bodybuilder or be on the CrossFit stage. Now I have to bring this up in every podcast, but I'm doing a Spartan race, so
No,
It's
that's like my thing that sort of keeps me going and I guess
yeah,
keeps me more engaged in it. Um, but it's not like I'm really like killing my body every week. It's more like I want to be in shape for the long term. I want to be functional as long as I can possibly be functional. Fight sarcopenia as much as I can.
exactly.
Uh, and when it comes down to it, for the normal person, that's what we're gonna probably want to do. Like we don't have to go be the best athlete in the world and destroy our bodies, and then by the time we're 40, have trouble going up the stairs because we destroyed our joints.
I mean,
Um,
when you think about it, like we need to work out, like you said, for the long haul. My big goal is when I work out the next day, I want to be able to function and still be able to work. Because if I'm, like you were saying, if I'm too sore to do anything, and then what good is that doing for me as well? Like, yeah, okay, I want to feel a little bit of soreness, but I still got to be able to move. And for the long haul, like you're talking about, Aaron, like we got to minimize injury risk. Like I remember when I was like 18, 19, 20, and I used to just try to do a PR in the gym every day. And you know what? It's not a good idea anymore, because you're risking the injury. I mean, I just got back from Italy with my fiance, and working out up into that moment, I was like, I got to just work out where I can still feel good, but I don't want to risk tearing a muscle before going on this trip.
mhm.
yeah, yeah. And I think one of the big evolutions for me personally as an athlete, but I think also in my role as a physical therapist too, is like being very intentional with what we choose to do and why we choose to do it.
Mhm.
And I think that has been an evolution for me across my career as a physical therapist, but also just in personal fitness as well. Is like, well, why am I going to do this particular exercise? What's the
Mhm.
goal? What's the point of it? And is this the best way to reach that particular goal or the point of that
Mhm. Mhm.
day of fitness exercise or that workout. So I think, really understanding what the intention is and then matching the what you're going to do to the why and how you want to do it and what you want the outcome to be, I think is an important principle for me in a lot of different facets of life. But fitness is a great place to look at it because you can really reverse engineer what your kind of fitness routine should look like versus trying to fit a square peg in a round hole, just bang your head against a million burpees and, super heavy,
Yes.
poor technique driven, performance focused. Not that there's anything wrong with that of working out at that level. If your intention is to go compete in the high rocks,
Yeah.
competition, or if you want to go and try to win the Spartan race, or if you want to go and try to make the CrossFit Games, absolutely, there's a place for that. But I think personally, that's not where I'm at right now. And I think a lot of my patients aren't necessarily looking to make the CrossFit Games. They want to be able to get down and play with their grandkids. They want to be able to carry the groceries up the stairs. They want to be able to bring the bags of mulch out of the back of their truck into their backyard, right? So I think, being intentional and understanding the goal of what you're trying to achieve, and then let sound kind of strength and conditioning and physical therapy and human movement principles guide you to what that plan should be, whether you're in a treatment situation with a patient or you're in a training somebody or training yourself.
Mm-hmm.
Yeah. No, it's very true. It turns into more of like functional style workouts, which is funny because I was just having this conversation with a friend of mine he's 22 and he likes to bust me all the time. And he's just like, oh, I can bench more than you. I can squat more than you. I'm just like, listen, I'm going to teach you when you're older what's called working out in your 30s. And you don't do that anymore because of the injury risk. It's the risk reward is when it comes down to it. There comes a point where it's like the risk of doing that isn't worth the reward of what you can get out of it. It's just, you can still look good, be able to move, get a hell of a workout, and do everything you need to do without having to risk the potential of an injury in the future.
Mm-hmm.
Sure. Yeah, one of the terms that I always like to keep in mind is like the minimal effective dose. The minimal effective dose is the least amount you need to be effective. And then there's the maximal effective dose, which is if you do any more than that, you're gonna cause your strain injuries and your overuse type injuries, right? And then there's like that optimal dose, which is somewhere in the middle. But there's nothing wrong with the minimal effective dose, especially if you're in a season of life where time is compressed or there's constraints on how you can train or your access to what you want to train, or if you're coming off an injury, is like, yeah, just hit that minimum effective dose. It's the minimum effective dose. It's effective.
Yeah.
And finding a threshold where you can do enough to meet the goals and the intentions of what you have for your workout, but keep yourself in that Goldilocks zone of like, I can train here and I can come back and train again tomorrow if I want to, and I can come back next week and I can come back next month and I can come back next year and I can keep evolving my plan so I can work out for the long haul as we've been talking about, but making sure we're not dumping into that other end of the spectrum where I can't come back and work out next week or I can't come back and work out next month and kind of driving the bus right off the cliff.
Mm-hmm.
Exactly.
Oh, I had my first brain fart of the day.
How did you have it first? I'm the one who's jet lagged right now.
That's a great question. I had something I was going to say based on what you were saying, and it completely left my mind. So,
It'll come back. It'll circle back.
So you were saying that you are doing a class at, what was the name of the gym now?
So the gym's currently called Between the Ears Fitness.
Gotcha. And we also have that you are a little promotion for you, the Schlarnetics 360. Are those correlated?
No, so they're two separate things. So the Between the Ears Fitness gym that I coach a class at is totally separate. Scholarnetics 360 is kind of like a whole nother topic. It's a mentoring platform. It just got launched earlier this year at CSM, and I actually kind of found it through social media, and some people that I follow were posting that they were getting involved in that, and I checked it out. And since I finished my fellowship training last year, I've been wanting to be able to teach and wanting to be able to mentor a little bit more. And so it's a really cool online platform. It's just kind of getting up and rolling. So if anybody's interested in checking it out or wants to, do some mentoring with me, you can check out that platform, and I'd be happy to connect on there if it's something that you're looking for anybody who feels like they're missing some clinical mentorship or at a stage in their career where they're not sure what direction they want to go in terms of like diving into something like a residency or a fellowship type training program, or getting into a track like Maitland or Mackenzie where you take a series of courses or something like that. You could always try out something like this Scholarnetics platform and be able to talk to some people or do some mentoring sessions either about career development or about clinic stuff and kind of how to treat particular conditions and stuff like that. So it's a relatively new platform that's out there that I'm going to be on and try to do some mentoring with people starting in the fall.
Interesting. So is it
That's awesome.
basically like they have a list of like mentors that you can have for a certain profession, and then they go based off of that?
Yeah. Yep. So there's a bunch of different mentors on there right now for some different healthcare professions, and it made so much sense to me that if it was something that I had available to me when I was either a student or a new grad, I probably would have jumped all over. So it's a subscription based service, and then you can kind of pick and choose or try different mentors out on the site. So yeah, it makes a ton of sense to me intuitively. That's why I signed up to be a part of it. But yeah, if anybody's interested, check it out.
I'm
I love
actually
that.
very interested in it too. Like that sounds like a great idea. I could see why you'd be interested in it too. It's like I usually get like a student maybe once a year, maybe one every 2 years. So it would probably be nice every once in a while to have something like that. Like actually be able to help people if they need it, especially like a lot of the new grads if they needed it.
Yeah, for sure.
No, I'm definitely interested too now because in my like clinic position, in a private clinic, my bosses are like too keen on having students join us, and I always love the idea of being a mentor. I just didn't have a platform because of it's just I understood with their business model they didn't really want to have the students in, but this gives me a little bit of a chance to know kind of maybe be a mentor in this way, so that'd be cool. Awesome.
Yeah, yeah, it's like I said, it's a cool platform. It's just kind of getting ramped up and getting started up. So hopefully it's something that grows. But any opportunity for me to be able to give back a little bit, to teach, to pass some of that knowledge on, I I feel, and Aaron, you could probably speak to this, having been my student, but like that ability to share information helps me organize it, right? And so I haven't had a student in the last couple of years. So same kind of thing with my current work setup. We're just working on trying to get students back in now. So I think having that ability to share from your experiences also helps the mentor or the teacher kind of organize their thoughts and their experiences as well. So
Yeah.
yeah, I think it's a good thing. And the more platforms or the more kind of avenues we have to help meet people where they're at, I think is a good thing. So anything to help improve the quality and the sharing of knowledge, so we don't all have to learn from the same mistakes, is I think a good thing.
Yeah, because we're all going to make mistakes, and we'd rather not have to
For
make the ones that we're all going to make anyway. That's for sure. But yeah,
Exactly, man. You know what? Mistakes are all about learning from them, so we grow from them. But it's better to teach your mistakes to others, so they can go on and not make, like you said, not make the same mistakes that we already made.
yeah. So we will definitely put that in the description of the video if anybody's interested, and
Glad to know.
we'll try to make sure we put that on Instagram when we put any shorts or anything up. We'll put that in like the description, comments, whatever it
Sounds
is.
good.
Going back to the classes, I mean, the you said the once or twice a week. I already forgot the name of the place that you said.
Between the ears, come on.
Between the years. Okay, I'm writing it down so I don't forget in 2 minutes. But like, what are the classes like? Is it? I guess it's a mix of a lot of stuff.
So it's a unique small group fitness setup. So typically has somewhere between anywhere from 2 to 6 or 7 people in like a class, and then during class, like all 6 people might be doing a different workout, but we base that there's 5 I think 5 or 6 different categories of workouts that they can choose from, and they choose based on what they feel like they need or want that day. For example, if I come into the gym and I'm like raring to go, I want to get after it, I really want to empty the tank, I might do a style of a workout that we call a capacity or an engaged workout, which are going to be your higher intensity metabolic conditioning style, something similar to like what you might think of when you think of like a traditional CrossFit, especially with that capacity where it's like, hey, 5 rounds of these 3 movements with 500 meters on the rower in between, and you are trying to crush it.
Mm-hmm.
Then we have another workout that's called like a flow workout, and we have some strength workouts programmed, and there's a cardio workout there. So based on like, hey, I don't want to do that super intense push, but I definitely want to work on strength. Hey, I might pick the strength workout today. If I feel like I'm just really sore, I've been beat up, I know I have a really busy day ahead of me and a long day, I'm gonna hit the flow workout today where I can kind of throttle up or throttle down based on how I feel and what I need. And we have a nice little like self-assessment sheet that takes into account kind of stress level, how did you sleep, um, where's your energy level at, how sore am I, all those a bunch of different factors that go into that self-assessment that then helps kind of as the coach or the guide help the athletes or the members taking class kind of fit them into the right type of workout that works for them, so that they get need. And the thing that I enjoy the most of it as like from the coach's perspective or from my perspective, is almost all the time somebody whoever is in class, they leave and this is my favorite thing they say is they're like, yeah, I got exactly what I needed today.
Oh,
Right.
That's
Yeah.
awesome.
So
That's the
if they come
reward.
in, yeah, if they come in and like, man, I'm just like, I didn't sleep well. I didn't think I was going to want to come to the gym, but I forced myself to come. And whatever workout we decide they fit into, the best part of it is like everybody kind of leaves feeling like, wow, I feel like I got what I needed today.
Yeah.
And helping kind of guide fitness where it's not a punishment. It's not oh, I feel like I beat myself up, so it was a good workout. But actually kind of matching what you need and kind of matching the person with what they need mentally, physically, and emotionally to kind of match their energy that day. It's been pretty cool to see people build better self-awareness through paying attention to what their body is telling them and then matching their how they're feeling to the workout they choose and then seeing the outcome of that is pretty cool. So
Mhm. It
yeah,
actually. Oh, sorry, Tom. You can go.
I was gonna say I love it because I mean, and correct me if I'm wrong, but it sounds like you're kind of combining like the like fitness physically with like even the psychological aspect of it too. Like you're creating a whole mind and body experience with it all, which I really love because yeah, like you said, like there are some days where it's like, yeah, you know, like I don't really feel like going to the gym. But you're taking those factors in and designing their workout around all of it based on the intake forms and talking to the person and figuring out where they're at and meeting them there. And that honestly is a part of like, you know, training and personal training, even that a lot of like, you know, not to knock, but you know, a lot of your average personal trainers aren't focusing on that. They're just focusing on like, okay, I need to work out your body in this part of it, but they're not focusing on like psychologically, mentally what's going on in that moment too, which can affect the physical.
And I've even
sure.
had like talking to friends and stuff like that would be like, oh, I really didn't do a good workout today. And then like, well, people will even feel bad that they didn't have like the best workout ever. And I'm like, all that matters really is that you went to the gym and you did something. And
You showed
in the
up.
long run, that's what's going to matter, that you're doing stuff every day. Like,
consistency
yeah,
consistency is king for sure, right? Consistency is king. And then I think also though to your Tommy, you mentioned like that psychological part of it. You know, the two owners of this Between the Ears Fitness Gym, Bill and Cariana Anthes, have really put together a unique program that does try to tackle that part of the equation, right? I think we've all probably seen or know people or have been at stages ourselves where you kind of go to the gym and you beat yourself up. You're like, God, I just feel like why couldn't I get that weight today? And it's like a negative emotional and psychological experience. Where in reality, like, you know, there's only 24 hours in the day. We only have so many days in the week, so many months in the year, and so many years while we're here. Like, how can we drive enjoyment and and find more fulfillment and let fitness be something that is a positive factor in building us up and not a negative thing that's again like self-punishment or um you know, weighing us down negatively when it should be something that's supporting us to engage in all the other facets of our life, right? Like I want my fitness program to help me be a better dad, to help me be a better PT, a better manager, to have energy to be able to do the things that I want to do outside of the gym. And if the gym is pulling away from that, it's like this kind of mental shift of like, well, how do I make sure that the gym is serving me in a way that I want it to?
mhm.
So it's been a very cool kind of journey for myself as a coach and having worked with Bill and Cariana for over a number of years, even at their previous gym. It's been a fun evolution to be a very small part of and help facilitate. So
And that's why I always say to people too, the best exercise is the one that you like to do, because it makes
Yeah.
you want to do it. Like there are some days, like I used to be like, oh, I have to do like a strength training workout every day, working like, I would always have the splits that you have to do all the time. And now I'm like, you know what? It's like hitting some golf balls in my basement. So I'll just have like a 30 minutes just hitting some golf balls. And it's nice. It's getting myself moving. It's working some muscles, and it's nice every once in a while. Like I could be consistent doing that a lot more so than forcing myself every single day to do like a bodybuilding type of thing.
Right. And to kind of connect it back to our day jobs as physical therapists, is like I
Yeah.
ask that question to patients often, especially right. I'm gonna like you paint that scenario of you have that chronic back pain patient, regardless of what their age is, they have maybe some beliefs about their low back that they're gonna have back pain forever. And kind of that question of like, well, what would you enjoy doing? What do you like to do? And how can we
Yeah.
make exercise an enjoyable experience for you? Regardless of if they are, what is their RPE scale and is their deadlift technique perfect? And are they using a barbell or a sandbag or a medicine ball or a kettlebell? Like that is all like details. But what do
Mm-hmm.
you enjoy to do? And if I design a rehab program, and let's say they're having a good outcome, they're feeling good, they're moving well, they're reaching their goals. It's like, hey, is this realistic? Can you keep up with this a few times a week, or do we need to tweak this? Do we need to change this, right? To try to get some of that behavior change and help them continue with consistent exercise that they enjoy and feels good to them, because somebody will continue with exercise if they find it enjoyable and they are seeing the results and the benefits of it. If they're like, this is torture and I can't stand going down and lifting this weight, for 8 sets of 10 that my therapist or my trainer told me to do, like eventually that like the motivation goes away, and if the enjoyment is not there, they're not going to do it. And I think that's
Yeah.
such a big role in physical therapy, is like, yes, we have this great level of knowledge in terms of how to help people move better, educate them on movement. But if we can find movement that they enjoy, not that I enjoy, not that Aaron or Tommy enjoys, but like what does that person in front of me want and what will they enjoy doing? And how can we craft a program then with all of our theoretical and textbook and course knowledge and get it to meet that person in front of us where they are? Like now we're talking about like, we're going to make that person potentially have better health outcomes for the next few decades, maybe not just the next
Mm-hmm.
10 days.
Yeah, you hit the nail on the head with it, because that's a big thing that I include in my eval. Like initially, like in my eval, the very last question I asked before going into the manual part of it, of like where I started to get a feel for everything. I was like, all right, what do you like to do, like socially, physically, like hobbies, like anything? I don't care if you like to paint and model cars. Tell me about it, because there's one way or another that I can kind of help factor this in for the long run. And then even just revisiting it later, just like, hey, listen, like what we designed, how do you like the exercises so far? What don't you like? You don't like that exercise? Perfect, it's gone now.
Yep.
Or try to get them to find a love for it. But if that doesn't work, there's a million different ways that you can get it to work.
Mm-hmm. There's a
Yeah,
lot of ways to exercise.
Oh, yeah.
100%.
Yeah.
100%.
And I also, just as I guess, been a PT longer and longer, I ask about pain less and less too. Like it used to be where there'd be times where I would just focus too much on the pain, and then people would just think about the pain every time I would see them. They'd be like, "Oh, this hurts, this hurts, this hurts." But yeah, as you focus more on function and what they're doing better functionally, it usually tends to help, because you start to not focus so much on the pain. And we talked about pain a lot when I was a student too. And the more you focus on pain, the more the pain usually feels worse. And our brain's already so hypersensitive. Just talking more about pain is going to make more pain, a lot of pain.
Exactly. The dreaded
Yeah.
P word.
Yeah, 100%. Right. And I think that's that's like some of the mental jujitsu that is like expertise in physical therapy, is like knowing when that patient really does need you to ask a lot about pain, and then
Yeah.
knowing when you need to not be in that intensely objective assessment, or like this trying to make a subjective experience of pain objective by asking like, all right, well, what's your pain scale on a 0 to 10? Do I ask that on eval? Yeah, I usually do. But do I ask it on every single follow-up visit with every patient? Definitely not, because of exactly what you're saying, is like you have to figure out in that pie chart like what's driving the bus here, right? If it's a purely mechanical problem and it's going to follow your kind of textbook mechanical response to treatment, I might be asking pain every time because I'm going to be expected to follow a specific pattern to our treatment. But if you have a lot of psychosocial factors and catastrophization and hypervigilance and a lot of these psychological things that are coming on board and is part of the story and is part of the presentation, we have to be respectful of that, because you can really bang your head against the wall, as you're saying, Aaron, of trying to nail down such a hard thing to describe that is the pain experience. If there are all kinds of beliefs and hyper focus and hyper awareness on where their pain is at, that you can actually just ramp the system up by asking them about it. So I think that's a cool point to see that you've gotten to that point in your career where you've learned that, because I think it's something that we all have to learn a little bit by trying, like, pushing somebody a little bit too much or asking too many of the wrong questions.
Yeah.
But the faster you sit there and learn, like, it's more than just a 0 to 10 scale out of pain on a pain function. It's what are you avoiding doing? What are your beliefs about your symptoms and the condition that you have? What if your family members and friends told you about disc problems, or that you've read on Google and the internet that are in your head and making you, believe things about your back or your pain that may or may not be true? We have to dig at the roots of those too, because if you can get to what's driving the bus, if it's a psychological factor, if it's a belief factor, if it's any of those other things beyond the mechanical, we have to make sure that we're not just kind of trying to mob our way out of maybe a belief thing, right? Like, we can give you some temporary if we work this unilateral PA to this segment, and do I do them? Absolutely, I do when they're needed, they're necessary, but also recognizing when you have to provide some of that education and almost counseling piece and motivational interviewing and coaching through it to understand, why are we doing this, and what is the expected result? So anyway.
One of my favorite things to do now during the start of sessions is I don't even say the P word really anymore. Patients they'll come in and be like, hey, how you doing today? Like, oh, good, oh, perfect. Let's hop on the table for a second. Like, whatever I'm working on, whether it's a shoulder or neck, like, I'll just start to move it, and I'll tell them what I'm seeing. Like, oh, hey, your shoulder's moving further today. It's doing pretty good. And they're like, yeah, there's a little bit of pain. I'm like, yeah, but look how much further you're going. Like, let's see the differences, rather than like, hey, tell me how it is. Because we've all had this patient walk in the clinic and you're like, hey, like, what's your pain today? Like, everything hurts. The world's ending.
Yeah. And I think it's so important to have, like, objective, observable asterisk signs. So an asterisk sign is just like a movement that you are going to track each session that you're aware of, but also you make the patient aware of, right? So, like, if it's shoulder range of motion, like, hey, look, you're getting your thumb about to your eyeball, and that's where it hurts. And they come back next time, like, wow, your thumb is like way above your head. That's really good. And kind of bringing the patient into your decision-making process of, like, these are the things that are important to me as your physical therapist to track, but also making sure that when I choose those things, there's things that are important to the patient. I'm not just picking something, oh, well, that hurts, I'm going to pick it. They told me they struggle reaching up to get their towel off the rack in the bathroom to be able to, towel off after a shower, whatever the example is, right? So I'm picking that range of motion because it's objective, it's measurable, it's easy for me to track, but it also correlates directly to the functional thing that they told me they're struggling to do, whether it's a 6 out of 10 pain or 5 out of 10 pain. Do I really care? No. Is it better than last time? And is it moving further than last time? Are you able to reach up and get your towel off? Like, having asterisk signs or those objective measures that you're going to cover in repeat sessions be meaningful to you as the therapist, but also meaningful to the patient. Wow, now we're rocking on all cylinders, because when we do treatment, when I send a patient home with a home exercise plan to work on a couple things, and they see that they're making progress, they're almost coming back and telling you, like, hey, look how much better my shoulder feels, right? Like, when you educate and not train the patient, but kind of teach the patient, this is what we're doing, this is why we're measuring it, this is what we're going to test next time. If you do your homework and you come back and we see it's better, the same, or not better, we'll know exactly what to change next visit. Like, you start to build in those processes and have that kind of clinic flow that allows you really to, like, maximize what you can get out of each session. And I know we're diving maybe into a little, like, clinical reasoning and critical thinking stuff with that. I'm gonna take that one step further and be like, I used to give patients sheets and sheets and sheets of exercises, right? Like 3-4 pages. Here's the whole Throwers 10 program for your shoulder pain. On that first session, if I send somebody home with more than 2 exercises, it's a lot.
I'm actually the same way. Like, at most, I give 3, especially my population. People tend to be terrible HEPers. So I'm like, if I could get this person to get up every hour, I'm going to be pretty happy.
There you go.
That's it.
It's all patient-client population dependent.
And like you were saying too, as far as pain goes, I've had so many patients that are like, "Oh, I'm not doing any better. It's still hurting so bad." And then like maybe they'll get up out of, like, let's say they have knee pain, they get up off a chair like way easier than the last time I saw them. Like, you just got up. I didn't have to do anything. I just got to watch you. Like, that's great. They're like, oh yeah, that is a little bit better. And then, like you said, they start to, it grows in their head that they're slowly making progress, and that tends to help a lot too.
Oh yeah. One big thing that I actually tell patients now, even at the start of like evals, I said, listen, like it's going to take a little bit of time for you to most likely see changes in pain. I was like, we're not going to undo what we created in 3 months in 3 sessions. But I said, what I want you to focus on is today is Monday. Next Monday, I want to think about what we're doing now that we couldn't do, or doing then that we couldn't do right now. And then each Monday after that, build off of it. Like, hey, Monday is our check-in point. Like, okay, we were at 90 degrees with the shoulder. You're at 110 today. And like, it's just something to kind of build off of, where it's like, hey, listen, yeah, your pain's still a 6, but you're 30 degrees further than you were before. Or you can now comb your hair with ease versus before you were struggling. Like, just little things that I kind of focus on. I think those are your checkpoints.
Yeah. One of the things we talked about before with like fitness was like being intentional and like kind of having a reason for why you do things. I think also in our eval approach, and when you are when you're kind of like picking what those asterisk signs are, those things that you're going to measure and reassess, and just like being intentional in how you communicate that to the patient, like bring the patient into your thinking and your reasoning and kind of what your thought process is, I think is very important, because if the patient can see and understand the why behind what they're doing, and for some patients they want a real deep why, and some patients only want to know a little bit, right? And that's like something that you learn to interpret. The buy-in is so much better, and that patient is going to be more likely to stick to the program if they can understand the why behind why I'm doing this exercise. The other thing that I think is important that we all do on an eval is we're trying to find the impairments, right? Hey, they have a lack of range of motion. Hey, they have some capsular stiffness. Hey, there's some weakness in a specific group of muscles around a joint or whatever. I think always like identifying the impairments that we need to work on and we need to put in the note to track, but then making sure that we're celebrating the wins and celebrating like, hey, here's the good news. Like, you actually have really good strength here and here, but this is the one we need to work on. Like, sometimes I feel like early in my career, I would like kind of tell patients this long laundry list of all the things I found that were wrong. But it's equally as important to tell them like, hey, this is good. Like, this is really good. This is great. This is the stuff that we maybe need to address and try to build a plan around. Are you cool with that? And I think that kind of questioning is important too.
Mm-hmm.
And that kind of,
and that goes into a lot of stuff too. Like, I guess we're mainly just talking about pain for a while, but also like I have a lot of like neuro patients, or maybe like patients with dementia, where if you just focus on like all the sort of negative stuff that they're not doing well, they're just going to be like, oh, well, I'm doing terrible. I don't want to do it anymore. But if you're like, hey, you're doing all of these things well, they're like, oh, all right, cool. I guess I'll keep on doing stuff and I'll keep working on these things. And you see a lot more progress in that way too.
absolutely.
So I guess we sort of went into pain already, but I know you were mentioning to me earlier that like cervicogenic headaches are a big thing that you've been, I guess, working with lately. Is there anything in particular that made you interested, that made you get more into it?
So the biggest factor, well, two factors I would say. So when I completed my fellowship training, definitely got a lot more confident with working with and treating the upper cervical spine, appropriately screening and knowing how to rule out or rule down more concerning conditions. So I feel more confident just kind of going through examination and treatment in the area. But at my current position, in my current role, we work very closely with a pediatric neurologist who is very collaborative with us in PT, which is awesome. I mean, he is walking patients back into the clinic and helping us get patients early. So we may see let's just say it's a 15-year-old lacrosse player who took a pass off the side of the helmet or collided with another player going for a ground ball, whatever it might be. And they come in and they have headaches. He does his examination, rules out brain injury, rules out any significant concussion or anything like that. but he is also screening for anything in the upper cervical spine. So any joint stiffness, mechanical signs, loss of range of motion, and he'll get them in with us, if not the next day right after the injury, if he's seen them. A lot of times the same day that a patient has a visit with him, he's trying to get them into physical therapy with us. So I've taken on a lot of those cases, and over the past 2 years or so, really built up a lot of reps with this particular patient population. And the fun part about it for me is it's one of those places where, a patient could come in with a headache, and if we address their mobility issues and provide some good targeted manual therapy and exercise, like they can walk out with zero headache after one visit, not need to come back to physical therapy again. So it's one of those like areas and conditions that can be a really rapid and significant responder. Um, so it's been a fun area to get to know from my proximity of just working next to the doc that we have in our office. So it's been fun, and I feel like I've learned a lot and got pretty good at it. So yeah.
So let's say I'm just a random Joe Schmo on the street. How would I be able to tell between different types of headaches? Should I just go to the doctor if I have a certain type of headache? Should I go to a physical therapist for some direct access? What are your recommendations as far as that goes?
Sure. I mean, it always depends on like what's the mechanism of injury, right? If you fall down, fall off a ladder off the roof, land on your neck and have a headache, if you have any of those Canadian C-spine rule conditions, like major traumatic event injuries, go get imaging, right?
Yeah.
Go talk to your doctor first. But especially if it's very mechanical in nature, hey, if I lay in this one position on the couch for 2 hours and watch a movie on my iPad, and I get up and I feel some neck stiffness and pain, and it starts to radiate up to the side of my head, and you get up and you move around, and it kind of gets better and settles, like that's kind of our classic cervicogenic headache presentation. And you certainly could come and see a physical therapist, especially somebody who specializes in this area or has experience in this area, will do a good job of asking all those appropriate screening questions to determine, do you need to go see your neurologist? Should you go see your primary care first? Should you go directly to the emergency room? Depending on what that symptomology is, and going through like a good, robust red flag screening process. Physical therapists absolutely can treat headaches. We're not going to necessarily have an impact on a migraine headache the way we would on a true cervicogenic or maybe a tension type headache. There's different other types of headaches out there, like a cluster headache, which we may not have as much of a direct impact on. So I think knowing some of the screening process and knowing the symptomology and the referral patterns and the different types of headaches that there can be, I think any therapist who has experience with headaches can kind of do that screening process and then decide, is this I can treat this situation? Is this a refer out situation? Is this a refer out but treat? Like, that's what we do. That's what direct access is all about, and our ability to do that medical screening and determine, is this patient safe to be in physical therapy with me? Absolutely. I think you can come see a physical therapist.
Mm-hmm. Yeah, even like you were saying, like someone sitting like on the couch, bad posture for a long period of time. Like sometimes it is just as simple as like changing your mechanics and how you do something like that. Like, maybe you don't sit like a blob on the couch for hours every day.
Yeah. Sorry, go ahead.
Yeah, my wife is an accountant, so of course we accountants have busy seasons, and she'll at worst probably work like I think 60 hours a week. So some days she'll work like 10 to 12 hours. And for a long time, she didn't have a standing desk. She would just sit there for hours and hours. She'd get carpal tunnel syndrome, or symptoms, I should say. It was never like diagnosed, but that's what it seems like it probably is. She would like get aches in her back, aches in her neck every once in a while. And then she recently got a standing desk. And then for Christmas, I got her a treadmill, for like under the desk treadmill. And a lot of those symptoms have gone away. Like she still sometimes wears like the carpal tunnel, like wrist braces, sort of seemingly more of a prevention or like a nervous about it coming back than actually it coming back. And I know the last busy season she really didn't get the symptoms at all. So it was, to me, a lot just standing, walking around, like giving your brain a break every once in a while and just getting out of the room.
Sure.
Mm-hmm.
Sure. Well, and we could dive, we could talk for a while about research and things that are out there, and posture. Mm-hmm. Does it matter? Does it not matter? And my quick spiel on posture is, it matters when it matters.
Yeah.
right? Like,
Yeah.
and when
Yeah.
it matters, it matters, and when it doesn't matter, it doesn't matter. And in that case, I think the other thing I always like to tell people about posture is like your next position is your best position. So too long in any one position, even if you have the perfect $10,000 ergonomic chair, beautiful work setup, like if you don't move your body for 8 hours straight or even an hour at a time, and like our body's designed to move, like you just got to change positions frequently. Standing desk, sit with the lumbar roll, take the lumbar roll out, raise the chair up, put the chair down, go stand at the kitchen counter. Like our body was designed to move. It's not designed to sit in front of a laptop or a computer or a screen for 8 hours a day and then get in your car and commute home or get on the train and commute home. So I think the more you can introduce movement, it really helps a lot of these kind of things improve. And that's a lot of what treating like cervicogenic stuff is like finding those postures or those positions or those movements that aggravate, and like, well, let's change that, and maybe we need to change it pretty significantly for a short period of time, and then allow you to kind of settle back into a routine with a little bit more movement and maybe a little bit more awareness of how to move better and more frequently, and like we can really clear a lot of these things up. Your
Yeah.
point
Oh, yeah.
into your story about your fiance.
Yeah.
I mean, I always tell patients it's good to just get up and walk around and move too. And then in my clinical experience, I see a lot of motor vehicle based patients. So I get a lot of like, I guess what you consider like more of like a traumatic cervicogenic type of headache, where I mean, they can be kind of, yeah, with the whiplash involved too. So I get them, I still screen, of course, too. I do my own due diligence, but I get a lot of them who have seen like, medical doctor, we've already gotten x-rays, we've been to the ER. So I know the major concerns are most likely not there, but I still do my due diligence to look out for the flags. God forbid something were to get missed. But yeah, they can get tricky that way too. But I tell everybody, like, listen, as much pain as you're in, you're gonna be in more pain if you don't move. So like, get up, walk around, even just don't be afraid to just gentle stretch your neck, move it around. It's like you're saying, it's better to be moving than not. We're not designed to sit.
Yeah, and like we can't expect to have perfect posture all the time. Like no one's ever going to be sitting perfectly upright. Like even just watching us on this podcast, like we're all going to be in different positions sort of throughout, going all over the place. It's not the end of
I
the
want to go
world.
back during this podcast, and every time that one of us has posture, I want to see if anybody goes like this immediately and just switches because it's like inherently driven in our head.
I definitely do every time. Anyone talks about posture, I'm just like, ew, is my posture bad again?
Yeah, I've been sitting like this the whole time.
It reminds me of like when I was actually like volunteering in a clinic to be able to go to PT school. I remember being in a clinic and there were some great therapists in this clinic, and one of them, they called her the posture police. Like she would like point you out from across from like, sit up straight, stand straight. Even me as like I'm like just observing in the corner, like, you're slouched forward, sit up straight. And I think like thinking about, and I'm just trying to connect back to something we talked about earlier because it just popped in my head, is like thinking about that, creating a positive experience like in the gym and like wanting to go work out. The same thing with like posture and like sitting is like, if we're like bashing people all the time, be like, you gotta sit up straight, like you gotta, like put the lumbar roll and always have it there and sit straight all the time, like we're gonna end up creating problems, like swing the pendulum the other way and at the other perspective. So I tell, I work with a lot of kids, right? Like especially teenagers involved in sports and things like that from our one of our referral sources. And so I tell them all the time, I do not need you to sit up perfectly straight all day long in this position. First of all, you can't do it, and you'll look crazy if you try to sit like that all day. I always tell them, like, listen, I just want you to be less like this and more like this. And when you catch yourself like this, beat yourself up about it. Just kind of like recorrect a little bit. Throw some chin tucks in there and like use that as your posture reset. So I think, again, trying not to beat people up about their thing, like tying it back to some of the stuff we were talking about earlier. It's like, make it a positive experience, make it something that's achievable and attainable that they actually can do. Because if you just like, yeah, you got to sit with better posture, it'll help your headaches, and they're trying to sit like this all day long, like, we're going to lose that battle anyway. That's like a zero-sum game. So I think meeting people and getting them what they need to be able to have a good experience with it, be like, oh, I don't have to sit with perfect posture all the time. I just need to be a little bit better than I've been. That's going to make a huge difference and can make a huge difference.
Mm-hmm.
Oh yeah, I tell my patients something similar where I literally just tell them like, I don't need you to be sitting perfectly 24/7, but if you can just correct it a little bit, even if it's just another 10% of the time, you'll see a world of difference that it's going to have on your pain, on your neck, on your back, on everything. It's like, it doesn't, like, I'm not perfect. I tell them all the time, like, I'll be typing notes. Next thing I know, I'm like this. And I'm like, oh wait, I got to switch. So it's human, but just
Yes.
10%. I was like, give me 10% and you'll feel a world of difference.
Mm-hmm.
Yep.
Every little
And I
bit
think
counts.
when you exactly, and when you can give patients like a little taste of success, and they can be like, "Oh wow, that actually does make a difference." Now it takes care of itself. Now they're going to be their own therapist, right? They're going to start to correct their posture when they feel themselves. "Ah, I'm starting to feel that tension that sometimes comes on and that gives me a headache." They're going to like, "Oh yeah, that's my reminder to do maybe some of my chin tucks, some of my stretches, whatever my therapist taught me," and like
Yeah.
it becomes a self-fulfilling thing where, like, if we hit the nail on the head, we do a great exam, we do good treatment, we help show them like, hey, this is mechanical, this is something we can help with, they're bought in, they believe it, and then they start to see that success, and like they do their home exercise where they're like, wow, I haven't had a headache, or my headache normally would be really bad and it wasn't that bad today, or it normally would come on at noon and today it didn't come on until 4 o'clock. Like, those are those little things that now the compliance with the home exercise program takes care of itself if you hit the nail on the head.
Mm-hmm.
Exactly.
Well, believe it or not, I think we're actually going to wrap it up there for today.
Sounds good.
Anthony, any comments, concerns, any last things, or any plugs you want to give before we wrap it up for the day?
No, this was great. I hope I think we had some good thoughts there. I feel like there were some common themes throughout some of the different kind of domains we talked about, which was cool.
Mm-hmm.
It was fun. It was fun having the conversation. So I appreciate what you guys are doing. I think the more that PTs and can have the opportunity to talk shop and share ideas is a good thing. So I love that you guys are doing this. I've seen a lot of the clips and stuff that you've put out and listened to a couple episodes, and it's great. So thank you guys for doing what you're doing, and thanks for having me on and letting me
Yeah.
chat and talk some of my experiences. But yeah, I mean, anybody who's interested in anything APTA or APTA New Jersey related, shoot me a message on Instagram, send me an email. I'm happy to talk about any of that stuff. If you just want to learn more about it or how it works, whether you're a member or not, reach out. I'm happy to have a conversation about any of that kind of stuff. And if you're looking for any mentoring, check out that Scholarnetics page. And yeah, those are my 2 plugs. So thanks again.
Perfect. Yeah, thank you for coming on too.
Yeah. Thank you,
Of
man.
course.
We thought it was a great time. Appreciate it. Definitely gonna look into the scholar that you're talking about, and looking forward to seeing what the APTA NJ has going forward as well. So a lot of exciting things.
All right.
Yeah, sounds good. Maybe we'll come back and do a part 2 in the future once our website's updated, and maybe we have some new updates to talk about APTA wise, or just to talk shop. So
Yeah,
appreciate
definitely. We'd be happy to have you on again.
I would say you took the
Cool.
words right out of my mouth. I was like, hopefully we can get you back on.
Sounds good.
All right. Thank you,
Happy to do
everybody.
it.
Have a nice night.
Night.